Hello, everyone. Good morning. We're back. This is the hashtag C Arthritis event at the 2018 Canadian Rheumatology Association and Allied Health Professions Association annual meeting. If I have to say that one more time, I'm going to fall over of exhaustion. It's a mouthful, but a very important mouthful. And we couldn't be happier than to have Leslie Soever with us, who is the president of the Allied Health Professions Association, and she's got 1 foot on one side of the fence as president and 1 foot on the other side of the fence as almost outgoing president. So we're really thankful that you've taken time to join us this morning, Leslie. Thank you. Also, congratulations on what I view as a very successful term of your association. I think you've done some amazing things. First and foremost, your incredible open hug to patient organizations and inclusion of patients in your pre-course. I think it's so important to have patient leadership and patient perspectives included in your work. Obviously, a heavy bias on my part, but thank you on behalf of all of the patient organizations that work to put on the C Arthritis booth and be involved in this meeting. We're very, very appreciative and happy you're here this morning.
Well, thank you, and thank you for inviting me to join in this conversation. And I do have to say, as the president and soon-to-be past president of the Arthritis Health Professions Association, we do truly value the input of patients, and that I would say I've had two-year terms as president, and over the last 4 years that has been one of my goals, and I think we have been quite successful in involving patients, as you mentioned, in our pre-course. And from time to time even consulting patients, and our volunteer webmaster, as you know, is also a patient, and so she always is constantly reminding us. She participates in our board meetings, that's Jennifer Boyle, of the patient's perspective, and we really have open ears to those perspectives. And as a next step, and our new president, Sue McQueen, is going to be leading this. We're doing some strategic planning. And just a heads up to all the patient organizations, we will be in touch with you because, again, we are going to be asking for your direction as we strategize for our future.
Fantastic. Thank you for that in advance. I know we'll all be very eager to participate and help in the ways that we can. Leslie, I want to ask you a couple of questions this morning. One is, because you've been a two-term president, which means you've done a fantastic job, clearly, what changes have you seen? What improvements, what challenges? Like, if you're just sort of to close your eyes and go, what happened this last 4 years? What would you like to say to our Facebook and Twitter Live viewers?
Well, one thing that I think has been a huge accomplishment is we have a new website, which we hope is more interactive. We're on Twitter, for example. We have resources on our website. We have opportunities for networking. So certainly I think we have become more digital, if that's a correct word. We've also really reached out to increase our collaborative relationships. And that has included our American counterparts, the Allied Health Professional Group associated with the American College of Rheumatology. We have a formal collaboration with them. And we've, at times over the last 4 years, collaborated with various research groups, including research groups that you're involved with here in British Columbia, others across the country. And research is one of our priorities, so that's very important to us. In addition, we have collaborated with the Ontario Rheumatology Association, and we're really pleased that they are welcoming us as a group. It is for our Ontario members, but we're hoping is that other rheumatology groups in provinces across the country will look at that model and perhaps consider it.
It's important work.
Yes.
For sure.
And I think just even networking, our three pillars are research, networking, and professional education. And the last thing I would like to highlight is our pre-course, which we have a one-day educational event prior to the actual CRA annual meeting. And over these years, it has increasingly become more popular.
Well, I had the good fortune to attend, and I have to say I was really blown away by the expansion of it, one, the incredible richness of the content, some incredible talks and different talks. So like if I were to put myself in your professional shoes, in your colleagues' professional shoes, I was really taken by the vibrancy actually in the room, not just of those participating, but the people that you brought in to speak, and the range of topics I thought was really amazing.
Well, thank you. And we are a very diverse group of professionals. We have nurses, occupational therapists, dieticians, pharmacists, social workers, researchers, physiotherapists. I'm probably leaving out a few
it's like the Academy Awards. Someone
is.
Always gets dropped off the thank you list.
Yeah, but because we're diverse, I feel that is such an advantage for us, because we have such opportunity to learn from each other.
Yeah.
And likewise, we try to have diversity in our speakers and our presentations.
Yeah,
so
I think that cross-pollination delivers a real magic, I think. And I don't think the public knows what allied health professions are. So that list you just gave, and if you've left any off, we're really sorry. But I don't think the public knows that. They don't realize that there is an association, that there is an association that focuses on arthritis and those specific specialties, and that you come together, which is really exciting for us. We often think, when I say we, I mean patients, we often think that professionally you're very siloed. The healthcare system may silo you in the way that they process us through the healthcare system, but you as professionals are not siloed at all. You're actually quite well integrated in both your learning and your practice knowledge and application of your skills. So, so thank you for shedding light on all of that for us. Leslie, I want to talk to you about precision or personalized medicine. And those words in direct relation to the allied health professions. Love to get your views. As you know, that is the theme of this meeting. Right. And you did have talks that were targeted towards precision medicine in your pre-course. And what struck me about one of the presentations was that you went so far as to carry that theme into the communication and how precise communication has to be, and I loved it.
Exactly.
I loved it. So share your thoughts with our audience.
Yeah, and I think, if you just take those two words, precision, personalized medicine, and you talked a little bit about the healthcare system, and I think that term precision can apply, yes, to communication. It does come through loud and clear and I think this is very exciting, about we're getting to the point where certain receptors can be targeted specifically by certain drugs, and that's amazing. Yeah. But as a physiotherapist, I'm a physiotherapist by background, and exercise is medicine, and I'm sure you've heard that term.
Actually, Dr. Lee just said that. She goes, remember, exercise is medicine.
Yes. And I think the important, if you really look clearly at what that means, is personalized exercise is medicine. As you know, people with arthritis have a common disease, but the presentation can be very different. Yeah. And the presentation is personalized for that person with arthritis, right, depending whether they're at a time when their disease is relatively active or well controlled. And at those points in times, the exercise can look very different, but it is still important. So I think the precision prescription of exercise at certain point in times is very important, and it should be personalized. And that leads me to our healthcare system that really promotes a lot of group activities, and there are numerous studies that show the evidence for the benefits of group activities, but at times we must not forget the individualized approach that cannot be attained in a group setting. Yeah.
So group is really great for motivation, for adherence, I understand, and other things. Yes. But we mustn't lose the personalized piece in that. Mm-hmm. So we're trying to get the personalization and the benefits of the group setting and combine them together. That's actually really a good reminder for everyone who's out in our audience. Let's round up our time together with your views on future. What do you see happening without the allied health professions? specific to arthritis, what do you think kind of is the next greatest widget or the next kind of thing, whatever it is, whether it literally is a thing or is an approach or a new tool of some type, a piece of research? What is it, Leslie, that sort of gets you excited?
Well, I think it is an exciting time.
Yeah.
I think there is a lot of energy and work that has been done for a number of years on models of care, and models of care that look at an interprofessional, shared care, collaborative approach to care for patients with arthritis, patients being at the forefront of what we all do. And I think the work that's been done is at the point where we're going to hopefully very soon see these interprofessional models of care implemented, not just talk about them, but implemented. And with that interprofessional approach, I think the patient is going to benefit in such a way that is very different than siloed approaches to care.
Yeah, you know, as a patient myself in the system, and those of you, this will probably resonate out in our patient audience, we see all these graphics and the words patient-centered care and all of that, and you know, you see people sort of placed inside of hands and all kinds of groovy graphics. But the models of care approach is one that is considerate of the patient at the center at every stage of their journey. And it's not just a one-way. I think a lot of people think of their journey through a model of care as linear and only once in one direction. But in fact, you're actually living in those sort of 5 key elements of a model of care your entire life with disease or with some other chronic condition. And it's that, and it's knowing as a patient there is a model, there is an approach, it is backed by evidence, and staffed by highly trained professionals like yourself that gives us the fullness and the richness in our lives with the disease that we not only need, but we want. And it's the bureaucracy kind of around the health system that I think we all struggle to work with us to get moving in that direction.
Yeah, and my hope would be that instead of having that linear model, that we all know there were points in time where those with arthritis need to re-enter the system.
Right.
And those points of re-entry need to be seeing the professional that you need at that time in a timely manner.
Yeah.
And hopefully with that interprofessional team, that will become much more accessible to patients.
Yeah, boy, I'm glad you raised that point about the ease of re-entry, because as patients, there's nothing more frustrating than being told you have a lifelong incurable disease. I have rheumatoid arthritis. That's what I was told when I was diagnosed. And then to fall out of, let's say I'm doing really well. I've been doing very well. I've had a rheumatologist for 20 years. I just went back to the rheumatologist. I had to go back and see the rheumatologist, and I got a call from their office saying I needed a re-referral. I'm like, okay, what a colossal waste of everyone's time and money. This disease is for life. I wasn't like leaving rheumatology or leaving my rheumatoid disease behind. So I said, why do I need a re-referral? So it's silly little things, Leslie, like that don't. So I'm hoping that's kind of what you meant about easing the re-entry point for patients and for practitioners. Actually, it's as much an easing the burden off your staff and time as it is, you know, my waiting, basically.
Exactly.
Yeah.
Exactly.
Really good point. Well, we can't thank you enough. Before we let you run off to your meeting again, we're going to ask the audience if there are any questions. So Anita, our fantabulous producer, is going to read any questions that have come in now to us.
Okay, so this is a question we have from email. This person has osteoarthritis and a very physical job that involves getting in and out of a car, bending and lifting. These activities, along with regular walking and standing, can be painful. Is there a way that he could minimize his pain?
So without providing, obviously, specific prescriptions or anything, what can you say in general about that?
Yeah, so I think in general, and this is my physiotherapy bias, but I would, if you haven't already, I would very strongly recommend a full assessment by a physiotherapist. And in general, sometimes just very specific, or an occupational therapist, or both, sometimes specific tips on specific exercises, for example, to strengthen certain muscles that enable you to do bending in a biomechanically correct way are helpful. Pacing activities, use of modalities such as heat that may help with the stiffness. There are a number of approaches that I think could be undertaken to help you modify activities to go through your daily work and hopefully activities that you enjoy in a more comfortable manner.
Yeah. Also, I can add to that, Leslie, that the workplace, arthritis is a tremendous presence and burden in the workplace. And our employers and the people that we work with do also play a role in trying to help us. So job accommodation can sometimes be explored if in fact you're willing to disclose your disease or condition. If you work in a large workplace setting, often there are services available to you to go. You talk to your human resource manager about some of the challenges. So depending on your specific work environment, it's a little harder in a smaller company where those resources might not be available. I was diagnosed with rheumatoid arthritis and have osteoarthritis, and I was at the time working in a small business. And I went to my boss and I just explained to her what was going on, and just that simple communication actually helped greatly, and we did modify some of the things that I was being asked to do. So there's different approaches. We're not sure that will solve all of the issues that you're dealing with, but we thank you very much for the question.
And can patients request to meet, you mentioned the importance of the group dynamic. Can patients request to meet with their entire healthcare team, say a physical therapist, their rheumatologist, their nurse, and a dietitian, all at the same time, so they can minimize the number of trips they need to they need to go to a doctor's appointment?
So a combined clinic sounds like, right?
It's a very interesting question, and we had comments certainly about that in a recent presentation I was in at this meeting. And that is a very important consideration, particularly for people who are living in remote areas and traveling a distance. We are very aware of that. And I think for sure I would encourage people to ask for that. It may not be that if you're asking to meet for those 3 people that were suggested there, that it's all at the same time, but certainly at the same visit to the clinic. And hopefully that team is communicating and working together.
There's also now telemedicine. There's video conferencing that actually physicians, rheumatologists, I think in some provinces, if not all, can actually bill for. So although there's nothing better from times of real crisis of the in-person visit with your particular healthcare professional. So I think we're going to let you go back to your meeting. We've taken so much of your time. We're so thankful, Leslie. It's always a pleasure. And again, our heartfelt thanks from all of the patient organizations, the Canadian Spondylitis Association, ACE, and the Arthritis Patient Advisory Board, ARC, Canadian Arthritis Patient Alliance. We are all very thankful that the HPA has been so welcoming of our participation.
You're most welcome, and thank you to all those organizations for your participation in our activities, because as I said at the beginning, we truly value your participation.
Wonderful. Thank you.
Thank you.